Hey, welcome to the live stream. Thank you for joining in. Hope everyone has had a good weekend. I'm Dr. Matthew Harb. I'm an orthopedic surgeon. I do a lot of minimally invasive hip and knee replacements in Washington, D.C. and Maryland. I'm just going to get on here, answer a couple questions, and anything you guys might want to ask, we can go over. Perfect. Thank you for joining. I'm also on YouTube as well. And I can see the chat from both. From Italy, hey, what's up? Welcome. Gomez, welcome to the live stream. Flowers Pretty, hey, how's it going? Thank you for joining in. Great, I had a really good weekend. Nothing too special, stayed local, but it was pretty good. No emergencies. That's a big thing. Hey, Rancy. Gloraline, hi. Thank you. Orthopedics is bone, muscles, tendons, joints, so we deal with everything from the neck down. Flowers asks, I have a question. How long did it take you to become an orthopedic surgeon? Well, it takes about 14 years. You have 4 years undergrad, and then 4 years medical school, and then a 5-year residency, and then a 1-year specialization. Hey, what's up? Sophia, how are you doing? Jojo. I broke my ankle. I want? That question, Brooklyn, that question doesn't make sense. I want my ankle one? Now it continues? Oh, I rolled my ankle once and now it continues to. Whenever you sprain your ankle, you can be at risk for future sprains. The most common ligament that's sprained is the outside one, which we call the ATFL. Scrubs on just for you guys, yeah. I was recording... I always record a couple videos, so, I do it in my scrubs. Or I throw them on and they were still on. Michael asks, what's the best time to get a tethered spine reconnected from a birth injury? It depends, how exactly tethered it is, what symptoms it is. I don't do a lot of spine surgery, and, that may even be a pediatric spine surgery. So it depends if it's causing issues. Permanently bent down, any advice? It depends where it's coming from. Is it coming from your hips? Is it coming from your lower back? So it depends where the contracture is. If I get thank you for all the double taps, likes, appreciate it. If I get a CPAP for obstructive sleep apnea, will I feel better? Usually obstructive sleep apnea can affect your blood pressure, affect your whole body, make you depressed. Thank you. Yeah, so if I don't see look, the chat's flying on both here and YouTube, so if I don't see your message, I will answer any subscribers first. So do I ever do 2 knees at once? I usually try to stick to one at a time. I will do them 4 weeks apart if a patient really, really wants to get them done quickly. I cut my middle finger, partially severed my extensor tendon at the tip of my finger, so you can't lift up there. Usually you can put it in a splint. If you put it in a splint for a little while, then it can get it to heal. You don't always have to do a surgery for that. Let me put Do Not Disturb on. There we go. Hey, what's up? How's it going? Brand, can trigger finger release require 2 surgeries? It can sometimes happen again. Gloralina says, as someone with obstructive sleep apnea and CPAP, I can absolutely say they make you feel way better. Icon, hey, welcome to the live stream. Thanks for joining in, whether you're on YouTube or TikTok. You drop any questions in the chat, I'll try and answer them. The other thing I'm doing, so I'm on the Discord channel. We're live in the Discord channel as well. So if you have any x-rays you want to post in the Discord channel, you can just go to my Discord link. It's in the description or it's up here. And you can post any x-rays. I'll go over them in the chat. I just had one knee drained, and they gave me a cortisone shot. Cortisone can be very helpful, especially if you have a lot of issues going on in the knee. YouTube boy, welcome. Yeah, I'm trying to increase my kind of long-form videos on YouTube. Live's a good way to do it. So trying to build up some little bit bigger viewership there. Thank you for the roses. BB Robbins sent over some roses. I appreciate it. Just had a blood clot in the lungs on blood thinners. Will it affect scheduling of the total knee? Usually when you have a blood clot, you're on a full dose blood thinner, and we usually want you to come on to what's called a prophylactic blood thinner. So they usually will wait probably about 6 months till after your blood clot. That's what I do. Do I do shoulders? I will treat shoulders non-operatively. I do send them to my partner once they're ready for surgery. I have a question. Why did I get such a long medical leave for having a fractured toe only? It depends, what you do for work. Everyone's different. What was my med school experience like? So, med school was busy. You work really hard. In order to get into orthopedics, you want to be at the top of your class. Some specialties are a lot more difficult than others, and orthopedics is one of those. So you need to have really good board scores. You need to be at the top of your class and do well on your step exams. What's recovery for cartilage transplant? It depends how much is done and what kind of cartilage transplant is. It could take a little while. It could take anywhere from 3 to 6 months. Do PRP shots work for the knees? There isn't great literature to support them. Thank you for all the double taps. Yeah, any double taps, any shares, comments, all that increases the viewership in the stream. We get better questions in here. Also, I have my Discord up if anyone wants to throw in some x-rays in the Discord. That could be helpful as well. Thank you for all the double taps. I appreciate it. How long of a recovery for a knee replacement? I'm from Maryland. I'm a tennis coach. I practice in Maryland. I have an office in Germantown, Maryland. And for, I would say, average recovery, most people make about 80%, 90% recovery by about the 8-week mark or so. You do make improvements even 6 months to a year after the operation. People start getting and working on agility kind of at the 2.5, 3 months mark. So you can start to hit a tennis ball probably around the 4 to 6 week mark, but side to side motion, pivoting, things like that, those are going to get better at like 3 months. How long does RSD take to resolve? Unfortunately, RSD does not always resolve. I will say a lot of the times it doesn't. You can do blocks, you can take vitamins, you can do nerve ablations. There's some vitamins that can help it. I would see a pain specialist who specializes in RSD. Unfortunately, it's a very difficult thing to have. Can you tell me why I get so much pain in my legs and then my feet? I need more of a description than that. I could list off 20 most common foot diagnoses, 20 most common leg diagnoses, but, things we do, we try to get a history, meaning we try to find out things that could lead to a diagnosis. And then we try to get a good physical exam, which unfortunately, virtually, I can't do a good physical exam, so I can't see where you're having pain and things like that. So a good description can sometimes be helpful. Ankle fusion. Sometimes we're doing ankle fusions if you have a lot of arthritis there and you're young. Can a fifth metacarpal plate and screw be removed? They can, but only if they're irritating. I would usually keep them in most of the time. Youngest person I've ever operated on? Well, in my training, I did operate on, children, but for hip replacement, I have done people as young as 18, 20 years old who had like a traumatic hip injury or a really severe deformity or a septic hip. Watching you from the Philippines, that's amazing that this goes across the world. I think that's just absolutely amazing that you can reach international audiences, which I love. Would you recommend a gamma nail rather than a DHS? DHS is kind of a cheaper treatment option, so it is used in other countries. Now, I'm not, most of the time I'm doing a gamma nail, not a DHS. If anyone has any x-rays and they want to drop them in the chat, we have some x-rays from before, but I have a medical Discord. Anyone can throw any x-rays in there. Thank you for all the double taps. Appreciate it. From Nepal, thanks for joining in. Nepal is beautiful, I hear. Definitely want to go there. Very small airport. What can I do for a trigger finger? It hurts when I sleep. You can get an injection, cortisone injection. So where the trigger finger is affected is at the pulley. The pulley is the A1 pulley, and that's right here. And so what we do is we take cortisone and we put it there right by the A1 pulley, and that allows you to flex down. KT tape. Some people have relief with KT tape. Physical therapists could put it on. What are your go-to pain medications after total knee replacement? Susan asks. And I use a couple different things. I use Tylenol, I use Celebrex. Then for narcotic-wise, I use Tramadol, and I use oxycodone for breakthrough pain. That's it. Oh man. All right, we're not going to read that comment. All right, moving on. Do you have more male or female patients? Probably about 50-50. All right. I broke my foot in my dorsal. So on the top part, sorry to hear that. Hopefully you're healing up well. Didn't need any surgery. I need a hip replacement. I'm 47. I'm in great shape. I lost all my joint fluid in less than a year. Very sorry to hear that. It's not uncommon, you know, especially if you're very active. Arthritis can form for a couple different reasons. It can form from autoimmune diseases. It can form from wear and tear, from injury. And so I have young patients who need replacements all the time. I have really, let's go, 10K. I love the support. Love it. So I have young patients who need hip replacements. The good thing about a hip replacement is you can be very active after. Sciatica is when nerve is pinched in the back. I had 3 pulmonary emboli following one year, no cancer, Eliquis. You know, COVID. Did you get the J&J shot? COVID can also increase blood clots, risk of blood clots. So there's a lot of things, especially in the last 1 to 2 years, that can cause it. There's not always a reason. I would also rule out autoimmune diseases or probably see a hematologist, oncologist. Kira asks, can you talk about meniscal tears? I have one and I don't know what to expect. Meniscal tears will usually heal up on their own. Meniscus is the shock absorber of the knee, so you use it a lot. It doesn't have a very good blood supply, so it's difficult for it to heal. And we'll sometimes do an injection, medications, anti-inflammatories, physical therapy. We'll get an MRI. In the worst case, we'll go in there with a camera to clean it up. Amy, thank you so much for the roses. I appreciate it. Let's see. Amy has become the top 1 viewer. Welcome to the top 1 viewer chart. Tracy, thank you for the roses. I appreciate it. Eunice, thank you for the rose. Thank you for all the follows, double taps. If anyone drops an X-ray in the Discord, I'll go ahead and talk about it. So I'm live on there now. Is unprovoked clotting disorder real? I wouldn't say that, you know, yes, it is real. But unprovoked means, you know, a couple different things. It means like something didn't cause it per se, but usually there's some type of cause. The most common causes are stasis, meaning if you were sitting in bed for a long time. You know, people can get blood clots from even riding on like a 4-hour airplane or a 6-hour car drive where they're not moving. Some people are just more prone to clotting disorders. There's things like factor V Leiden. There's a bunch of other things they can test for to rule out different clotting disorders. I kind of ask when I go down the stairs, my feet make cracking or popping sounds so much, but it's not hurting. My feet do that too, so it's not uncommon. Yep, Dr. Sood is in the Discord. We got a couple different doctors from TikTok in the Discord. What do I think about chiropractors? Chiropractors can be, I do have patients who go to them for relief, so I wouldn't discount them per se, but I'm usually sending to a physical therapist first. Amy says, I'm a surgical tech doing mostly ortho. Do you have a joint implant that you prefer? For knees, I'll do a lot of Donjoy and a lot of Stryker. And then for hips, I do Donjoy, and I also do DePuy for the hips. So those are kind of my main implants. I've used every system before, but it really depends on the patient's anatomy. I use computer templating to try and fit the implant to the bone ahead of time and get a good custom fit. But those are my most common systems I use. I have osteomyelitis, several surgeries. What are my chances of it recurring? It can recur, you know, you are at a little bit higher risk because you have it, you know, but if your ESR, CRP, meaning your blood inflammatory levels are low, then, you know, it may not always recur. Let's see. Let's do that. Have you broken a bone before? All right, does cortisone shots make your sugar higher? Not always. You know, early on there's a slight elevation, but if you're diabetic, it could be slightly more. You know, in that initial couple days, yes, it will go up, but long term it usually comes back down, and it's usually not significant enough to really interfere with sugar metabolism, but you can get an early spike. How late is it to remove internal fixation from a fracture that is healed? There's no too late. I would say we don't really take stuff out unless it's causing you pain or discomfort. The reason is there's usually holes in the bone, and those have to heal and fill in. Susan says, do any of your patients use trekking poles after surgery? Yes, I do have patients who use trekking poles. a lot of the times I do have patients who are really active who I've replaced their joints too, who like are doing really big hikes and things like that, so they're using trekking poles as well. Why do you get a trigger finger, and is surgery the only way to fix? No, you could do a cortisone injection. There's not one specific reason why you get a trigger finger. Does metformin cause bone pain? Usually not. NSAID anaphylaxis, afraid of Tylenol, center left thigh pain above the hip. You could get an X-ray, see if you have any bone-on-bone arthritis. If it's really bad, you could get an MRI. I need to be verified. The only way I think I'll get verified is if everyone just comments on my videos and comments like at TikTok. But other than that, I don't know if I'm gonna get verified. I do have like news articles. Like I've, if you Google me, there are a bunch of news articles on different sites, which, I think is one requirement. Maria, thank you for the. It looks like a baby. Thank you for the person. If they want to verify me, they can. But there was a point where there were a lot of fake accounts that were being made with my name. I had to report them. But even that wasn't enough to verify me. So you guys probably have to comment at TikTok to get me verified. What state do I practice in? Washington, D.C. and Maryland. If you're considering a hip or knee replacement, I have really good guides on my website. I also have a Discord chat. So my chat is up. If anyone wants to drop their x-rays in the chat, just click up here, go to the Discord channel, hit the plus sign, and then you can drop your x-rays and I can look at them in the chat. Arthritis on the top of the feet. Best treatment besides NSAIDs and orthotics. It really is a good treatment. Ruling out any other conditions, autoimmune conditions, things like that. Vitamin D, calcium can all be helpful. What causes a bunion? A lot of bunions are formed from shoe wear, from poor shoe choices, where they're too tight or high heels or things like that. So those can all form bunions. What is a good knee brace? If you check my Amazon store on here, you click up here, go to my Amazon store, I list a couple knee braces. There's a couple different companies that make them. Bragg, Donjoy are good brace companies. I had a few surgeries and the doctor took a bone out of the bottom of my spine. Very sorry to hear that. Hopefully you're doing well. Thank you for all the follows. Nell, Nana, Carol, Sherry, thank you for the follows. Can knuckles be replaced? There is a replacement for the knuckles, but it doesn't work very well, so we're not usually doing it. We'll do a fusion instead of a knuckle replacement. Achilles surgery next week. Suggestions for recovery. Well, your surgeon should give you a recovery protocol and a recovery plan for that. So it's really just about getting the tendon to heal. You'll probably be in a boot with a lift for a while. I'm echoing. Is anyone else hearing an echo on here? It may be speakers. Terrible Achilles pain. Yeah, I think you're isolated with the echo. So Achilles pain, we usually lift up the heel. All right, so we got our first x-ray in here. Let's see. Oh, that's not good. Yeah, that's pretty bad. So I'll pull up this x-ray. So this just got posted in the Discord channel. What do you guys see? So what do you guys think is going on with this x-ray? All right, so a couple different things. I'll go over this. Yeah, broken. So a couple of this is the carpus. The carpus are these bones here. You can see it's all slid over. We have a distal radius fracture here, so that's actually into the joint. That's called a radial styloid fracture. We have an ulna styloid fracture over here. This one usually heals up on its own, doesn't need surgery. But, this is a pretty big injury, so a lot of the times for this much displacement, we're doing a surgery to fix the radial styloid. Okay, so 63% of our chat has broken a bone before, 31 hasn't, and 4% don't know. All right, so this is a broken distal radius. Someone posted this in the Discord. I am reviewing x-rays that are posted in the Discord. So distal radius, so at the wrist, broke the radius, broke the styloid, so probably a surgery for this one because it's so displaced. There's also a split down the middle. So radius bone is on the side of your thumb. That's right here. Ulna bone's on this point. That ulna styloid, you have a bunch of ligaments that go in there. The radius holds all these bones in place, so it doesn't just slide out of the way. Probably get a surgical operation for that. Pain in the fingers, needles, not constant. What could it be? So, Mez Merlin, my questions would be which fingers? So, carpal tunnel, the nerve goes right through here. If you have the thumb, 1, 2, 3, and half of your fourth digit, this half, that's usually your median nerve. So, that's what we call carpal tunnel syndrome. All right, so we got some people filtering into the Discord chat. We got a bunch of other TikTok docs in there too. We got Chet, who's a spine surgeon, Dr. Sood. Ty, who is emergency room doctor. I think we got C the Med Life, who's in there too. So we got a bunch of people in our Discord chat who have just been interacting. All right, we got another X-ray. Let me pull that up. Oh, we need another song. All right, let's do something a little different. All right, so I'm 45-year-old female former athlete. I play a lot of tennis. So my question would be, what's the big issue here? So it looks like you just posted your hip X-ray. So we got a hip X-ray here. These are active stems in good position. It looks like you probably had an anterior hip replacement just based on the stem and the position of the cups. So that looks pretty good from there. And then the knees, so you've had a lot going on. You have arthritis. You had arthritis in both your hips. Now you have, it looks like you had ACL reconstructions on both your knees, which is impressive. On the right knee, you have a lot of calcification. So one of the things that I see on the right knee over here is there's a lot of calcification in between. And so that can be calcification in the meniscus, can be a sign of ongoing trauma. You have some bone spurring over here, a little bit of a bone spur. You know, one thing that may be helpful is to get an MRI of the knee, see how the meniscus looks. It's hard to do a partial knee replacement if you had ACL reconstructions. Now, it's not, 100% the wrong thing to do a partial knee replacement, but there's a higher failure rate, especially if your ACL is incompetent. So a lot of the times if you had ACL reconstruction and really severe knee issues, for you, obviously, I would try cortisone injections first, see if that helps or buys you any relief. If that doesn't, you could always get an MRI to see. Yeah, the right knee looks a lot worse. Your meniscus looks completely gone. I would probably do a total on the right. The left, you may be able to get by. You may never need a replacement on the left, maybe just injections. But the right has that big bone spur on that outside portion, so it looks like you have some instability there. I wish my ortho had time to make TikToks, so I might have a chance for an appointment. Yeah, is your doctor backed up like 6 weeks? That's why I like doing this, because it gives people a little bit more insight into some of their conditions, which they may not have time in the office for. But I do virtual visits as well. I do telemedicine. You can go to my link in my bio. And then, we answered a couple docs in the chat. Sometimes we'll help out, talk about things education-wise in the Discord. So if anyone has x-rays and they want to throw them in there, feel free. How long is recovery time after the surgery fix for spondylolisthesis? Well, usually you want a fusion in the back, so it could be a little while, 3-4 months maybe. Thank you for all the follows. Terrace Mag, Sweet, Page, thank you for all the follows. What do I know about 12th rib syndrome? 12th rib syndrome, it's not something we're commonly diagnosing. It's more common in men. Sometimes we call, it could be costochondritis. Sometimes we'll do a steroid pack for it. There's not much surgery or anything like that to do. Obviously rule out other disease processes before doing that, but it's not a common diagnosis we make. We're usually trying to find something else. Hello from Panama. Thank you for joining in. Appreciate it. Welcome to the live stream. But if anyone wants to drop some x-rays in the Discord, Discord's open. We got 2 people who have posted. We've gone over our hand x-ray, we've gone over our hip x-ray, we've gone over our knee x-ray. You just click down here, go to general, click down here, and then you can drop in whatever x-rays you want. What's a good way to strengthen my ankle because I fractured my fibula? Core ankle exercises. They can sometimes send you for physical therapy for that, which can be helpful. Can you have both carpal tunnel and cubital tunnel? Yes, you can. You can have carpal tunnel too and cervical spine issues as well. We call that double crush. Sometimes we'll get an EMG or nerve conduction study to rule that out. How many years of schooling did you have to go to? About 14 years of schooling. I have scar tissue that keeps growing back. I don't have x-rays. Is the scar tissue inside your knee or outside your knee? If it's outside the knee, I have a really good gel in my link in my bio for scar cream. I have ACL surgery next week. On my left knee, I had a meniscus allograft transplant on the right. Okay. So yeah, meniscus transplant's a big operation. I have had some people who have had that. You know, it lasted them maybe 10, 15 years, but then they actually came in for a knee replacement. So is gout a bone issue? Gout's a couple different systems, but it does present, you know, if you have recurrent gouty inflammation in your joints, then it becomes a bone and joint issue. Thank you. We got to 10K likes. Appreciate all the double taps, likes, follows, any subscriptions. You know, you guys are excellent and very supportive of this channel. Is a knee MRI that's 2 years old to evaluate on bone on bone? Bone on bone, you could see on a knee MRI. You know, you don't always need a new one if you are considering replacement surgery or anything like that. I'm post-op 2 years from a femur surgery. My knee still hurts when I stand and goes away. Any idea? Depends what surgery you had. Don't have x-rays, but I have an MRI report. Can that help? Yeah, that's fine. Drop the MRI report. Just blur out your name, blur out your details, meaning blur out your name, blur out your date of birth, all the stuff at top. You could just put the report or the conclusion in there. I had a total knee replacement 4 years ago. Swelling never went down. I have pain as well. Very sorry to hear that. You could get infectious labs to rule out any type of infection. You could get a bone scan to rule out loosening. It's lower back for spinal stenosis, a long recovery. You know, any back surgery is a big recovery. It could take 3-4 months. Is rheumatoid arthritis and fibromyalgia connected? Yes, they can definitely be connected. They're both rheumatologic disorders. Rheumatoid arthritis in itself can cause multiple joint pain. Usually I would say the fibromyalgia or multiple joint pain is probably from an underlying rheumatoid arthritis. What can be done for Kienbach's disease? Thank you for the fire and the flames. I appreciate it. Thank you for all the follows. Kienbach's, you can drill. You can do a drilling for Kienbach's, sometimes a little bone grafting procedure, and rule out why it's happening. Sometimes they do like a core decompression for it. I've had ACL surgery and osteotomies on the same knee. How will my replacement do? It's fine. I've done replacements on people with osteotomies or ACL reconstructions. Obviously, anytime you've had a previous procedure on a joint, it always makes you at a little bit higher risk for having a complication. Am I more at risk for an infection with lymphedema? Yes, you are more at risk for an infection with lymphedema. Unfortunately, there isn't a cure for lymphedema, but it can also increase the swelling a little bit, especially in the short period. So, redone. Can you not tell knees apart on an MRI? No, usually the knees are labeled like right or left side. And then the date that they were done. Kim asks, I'm a Mako MPS. Have you tried Mako? Yes, I've used Mako before. I don't currently use Mako. But it is a robotic knee replacement. The reason I don't use it is it's an extra CT scan for the patient. There's extra pins in the bone. You need a bigger incision. The timing can actually be a little bit longer than a non-Mako knee replacement. So for routine knees, I'm not doing robotics. I need one. My doc told me I'm too young. I'm 57. 57 is not too young for a joint replacement. Do I ever use Belbuca? It's not something I'm normally recommending. So look that one up. Buccal film? Yeah, no, not something that we're commonly using. I had my total knee replacement at the age of 38. Hopefully you're doing well. Thank you for the shares. Appreciate it. You must have had pretty bad arthritis to get it done that early. I have fibrosis of the lungs. It's fibrosis of the lungs is never good. If knees are labeled wrong on an MRI, does the MRI have to be redone? it depends. If you're going to do a surgery and, you know, it's a surgeon who didn't order the MRI, I would just go to the radiology office and have them correct it if they really did the wrong knee. They should be able to do that. How long does an ankle replacement last? Probably, I think the longevity is like 15, 20 years. Partial total knee replacement came loose after 3 years, so you need a conversion to a total knee replacement. Not uncommon. The most common reason for failure of a partial is a progression of arthritis or a loosening. How successful is cartilage replacement surgery? It can be successful. Depends how bad the damage or defect is. Taking meds on the reg for arthritis, is that bad for the kidneys? If you're taking an NSAID or an anti-inflammatory, then those are filtered through the kidneys. What do you think of steroid injections for chronic back pain, herniated discs? I think it can be helpful. How common is it for screws to back out of the bone? I would say it's not uncommon. It depends what area they're put in and, how active you are, but it can happen. Screws can back out of the plates. The biggest thing is that the bone is healed. If the screws were put in, they were put in to fix a fracture, and if the bone's healed, then, everything's good. And we just have to get that hardware out. Thank you for the follows. I appreciate it. But, okay, let's see. We got an MRI report in the Discord channel. Gel injections can be helpful. Wow, I don't even know if I can see this. Open original. Let me try and... Oh, here we go. Okay. MRI shoulder with contrast. So this is I'm just going through this report on the Discord channel. Let's just go down to the bottom. We'll go to the impression. So you have a superior anterior labral tear from 12 to 4 o'clock, or some heterogeneity, so it doesn't look normal. So one way you could see that, you could go in there with a camera into the shoulder to see that. You have tendonitis around your biceps without a tear. That's good. You have articular-sided fraying of the supraspinatus tendon, which is the rotator cuff tendon. So some rotator cuff tendonitis. You have some AC joint, which is at the top of your shoulder. Degenerative changes, which is some arthritis. So they think maybe some subacromial impingement, meaning as you move your shoulder, it's impinging there. You have some effusion, some swelling in the joint. So yeah, I would probably, this doesn't look like anything for the shoulder that I would operate on right away. I would probably try an injection. There's 2 spots you can get the injection. You can get the injection subacromial. They usually go in from the side, or you can get it intra-articular. I would probably try one. If it doesn't work, try the other one. And then if none of that works, you could go in there with a camera to try and clean up the shoulder labrum. I had both knees replaced this year. By the end of the day, they're swollen. Any help? Ice elevation, continue to get stronger. You're not a year out. The swelling will come down even after a year. Madhan asks anything to a budding orthopedic. So find a mentor, do research, make really good grades, volunteer, shadow. Research is number one. That's going to separate you out and get you into orthopedics. You missed my X-rays of screws on the Discord. Let me see. X-rays of screws. Sorry if I missed your X-ray. Oh, there we go. Got a screw in. Isn't the bone still too far apart to grow? Okay, I see. So for you, this looks like did you have a bunion surgery? Is that what you had? Let me see. So Winaki shows a X-ray of his foot. This is a lateral X-ray, so this is the X-ray of the foot. Thank you, Melissa. Melissa just became the top viewer. Thank you for the fire. This is a fluoroscopic shot, so an intraoperative X-ray. There's a little space there you can see, but we want to see the other view. So usually when you do a bunion surgery, you cut the bone and you shift it over. So if you're looking down the where it's shifted, then it may look like it's really far apart. So we want what's called an AP view, where a shot that we're looking at the top of the foot, so we can see on top if the bones are next to each other. If the bones are next to each other, which I suspect they probably are, it's hard to have the bones like apart in this area. So the bones are probably next to each other, just shifted a little bit. So that'll probably heal. Most of the time those do heal. How do I mirror my lives onto onto YouTube? It's a complicated process. I use OBS. OBS is a recording studio program, and then in OBS I basically use a capture of my phone screen, and so I can bring over my phone screen, and then I have an extra microphone set up, and then I'm running it through a separate computer. So my computer has an input as well, and then there's another way. If you want to get audio from your phone, you have to like open up QuickTime on your computer, and you have to mirror your screen. You have to mirror your screen to the computer, and then after that, you have to basically use you have to download a separate program to get an audio capture from your PC, so you can actually, if you want to stream screen capture and audio. But if you're just doing a screen capture, then you can do it just through a USB-C cord. I used to do a lot of computer stuff, so I used to do like website design and things like that, and back in the day. So, but it was not an easy process to get the mirror. There are services. So the other way you could do it is you could get a stream key. So I do have a stream key. Stream key is like how the people who stream on Twitch or stream like Modern Warfare 2 or things, or some of the games on the live streams stream on here. So I have a stream key, but I haven't quite. It's easier to utilize this because for the stream key, then you have to pay for an extra service called Restream, which is an extra cost. But this way it's free and you're just doing it yourself. Hey, what's up? How's it going? Welcome to the live stream. Yeah, if Dr. Shah wants to know, just have him reach out to me. I was texting him the other day, but he can just reach out to me. I've had 2 hips replaced now, and I need a lower back fusion. How long will I be down? It could take 3 to 4 months is an average recovery, probably. You want your bone to heal. Gambling debts. That's a great name. What kind of gambling debts are they? Hopefully not Wall Street debts. Acetabulum mesh with a mesh cage, 12 screws causing pain. Any thoughts? Sounds like you've had a big revision. It's really hard to take all that hardware out. That can be very. You can lose more bone in the process. All right, so we got some more pictures in the chat. So I had a bunion surgery, so you can see here on this x-ray, yes, there is a little bit of a gap. You know, that's the problem. Is it going to heal? Some people do 2 screws. Some people do a plate. You know, did you have a surgery with an orthopedist or with a podiatrist? Would be another question. Nothing too crazy. I'm a responsible gambler. Well, hopefully you're up. Hopefully you've won on your, and you don't have debts. Megan asked, do you really have to stop smoking in order for the bone to fuse? A bone can fuse if you're smoking. Now, what smoking does is the small arteries and blood vessels don't work as well and get closed off when you smoke. So yes, a bone can still fuse even if you smoke, but does it lower the risk and increase the risk of what's called a non-union for it not healing? The answer is yes. So, you know, before I do a hip or knee replacement, I try to have patients quit smoking for about 6 to 8 weeks. I wish I could go for observation of one of your hip and knee replacements. I do have people who come observe me for hip and knee replacements. I do have other surgeons who come in and watch me operate to learn techniques and things like that, and to learn how to do joint replacements at an outpatient surgery center, because that is more of a newer technique for rapid recovery joint replacement. My dad has EHL weakness due to L4, L5 disc bulge. Does it recover with physical therapy, or does he need a microdiscectomy? So if he can't lift up his foot or toe, you know, obviously you don't want to go on to full foot drop. You could try an injection, you could try physical therapy. If none of that works, then getting the disc taken out may be most helpful. Thank you. What are some of the damages that are caused by flat feet? If the flat foot goes out far enough and long enough, then you can get ankle arthritis, you can get knee arthritis, you can get hip and back problems. Wish I knew which end to start at. Do you have a suggestion, Nick, or lower above knee amputation? Hips. Well, usually amputation is the last step. You know, if you're trying to get a bone to heal, there's a lot of different techniques. I keep hearing that. Bergeron. Patrice Bergeron. I keep hearing that. Double life. Doppelganger. Yeah, we try to get BMIs down to about 40 or less before joint replacement. Can you do anything at home to try to correct flat feet or knock knees? So that's what we tend to see is when you have severe flat foot, your foot goes out and then your knee goes out into valgus. You get a knock knee and then you get arthritis in your knee. So many people who have a valgus deformity of your knee or knock knee, you look at their feet, they tend to be flat-footed as well. So one usually follows the other. Yeah, I've looked him up, but it's funny. I do these lives, and everyone comes on here and says that. I feel like out of all the people have said I've looked like, they say that one the most. Huge bone spur after PAO. Unfortunately, if a PAO fails, the only real treatment may be a hip replacement. Usually, MRI is for disc problems. All right, let's see what else we got in the Discord channel. Christian posts, I had a partial meniscectomy, and it's worse. New MRI, my doctor said I have arthritis, but it still looks, if I bend a certain way, it gets stiff after sitting. What can be done? You know, so these are what we're looking at. So these are the images of the knee. This is looking inside a knee. This is you can kind of see the meniscus over here, cartilage. I can't see big cartilage defects. It's hard to say, you know, without being in the knee itself. But your meniscus looks okay. Your ACL looks okay. But, you know, he was the one in there looking around. So if he saw some damage or arthritis, it could be helpful to get a new updated X-ray. I'm located in Washington, D.C. and Maryland. I also do telehealth. People do travel for surgery. I see you live all the time. Are you always working? Yeah, I guess I'm always working if you call this work. Do I stream on Twitch as well? I created a Twitch. It was too much, and so I don't. If you guys have kept up, like Twitch is dying. Their partnership program, they don't really support their creators as well as other platforms. So I think like in the next couple months, you'll probably see TikTok and YouTube outperform Twitch. So even a lot of the big streamers on Twitch are shifting away from that platform. So that's not something I really want to get interested in. I was doing like a triple stream. So I was streaming from TikTok to YouTube to Twitch as well. But I think it's just more for the gaming community and not, you know, I don't think that's a good platform for me, so I kind of steered away from it. On call now, I have to go back in for a left hip replacement. Well, good luck. I hope it goes quick and fast. Yeah, Twitch is a snooze fest lately. I agree. So glad you're here. Love the information. That's my goal, to provide as much information to you guys as I can. Looks like we have some more images. Okay, yeah. You have some arthritis. So it looks like these images coming through are the lateral compartment of the knee. So you can see your meniscus, you don't have very much left. You can see there's actually some damage, especially in this picture. This is supposed to be nice and smooth compared to the other side. It's not. So you have some lateral meniscus damage, and then you have a lot of damage on that lateral side of your knee. Who do I have winning tonight? The 49ers or the Broncos? I don't know. I'm in my fantasy league right now. It's a tight race. I'm in a fantasy league with some of my partners, and I think I'm behind by like 9 points right now. Oh, I'm up. No, never mind. I'm down. Yeah, I'm not gonna win this week. These are my fantasy scores. I thought I had a really good team, but I'm down 108 to 82. I guess it's all backwards for you guys, but yeah. Anyway. What's the procedure for fixing flat foot? So it's usually a reconstruction. procedure. I thought I drafted my best fantasy team ever this year, but scheduled for a total knee with a spinal in 10 days. How awake can I be in the surgery? So it depends on your surgeon. I have had patients ask me to be awake during the procedure, and I have given them a Bose headphones. That is the rare option, but at my facility I do allow that. Not all facilities allow that. Most of my patients sleep. They get the spinal and they go to sleep. What does arthritis look like? It looks like the cartilage surface is worn out. How long does a bone take to heal? If you break it, it can take 8 to 10 weeks to really heal. Is it necessary to exit my distal radius implant? It's been in 9 months. No, it's not necessary. ViewMedi is a great source for surgical videos if you're interested in watching them. But I appreciate all the support for the stream. You guys are great. I'm going to continue to answer questions on these on this platform and continue to stream. So I really appreciate all the support. I hope everyone has a great week, and I'll be doing more of these live. So if I didn't get your question, you could drop it in the Discord and or ask it next time I'm on.